Hi folks, I'm Dr. Michael Jones, President of the Medical Exercise Training Institute, and I'm the originator and founder of the Medical Exercise Specialist Workshop and Certification. For the last 23 years, our medical exercise specialists around the world have been providing medical exercise training solutions to clients with musculoskeletal, neurologic, cardiovascular, and metabolic disorders. So in this video, I'd like to talk about how we manage an ACL reconstruction utilizing exercise. Now, I got Mike here. He's one of our medical exercise specialists at our facility here in Houston, and he has an old ACL tear from years ago when he was a high school star, and that ACL tear, ironically, re-ruptured. So he's got a bit of an unstable knee. So I want to just talk about some of the basic anatomy and pathology of the ACL tear, and then we'll get into the exercise components that we need with his program. So Mike tore his ACL playing basketball, or was he playing football?
Pivot move basketball.
Okay. So the typical ACL tear, the foot is planted, there's a rotary component, and you felt a loud pop or snap.
Correct.
Okay, and you had the ACL reconstructed.
Yes,
correct?
sir.
Now, the ACL is reconstructed because the anterior cruciate ligament is the primary stabilizer of the knee when we're participating in athletic activities, cutting, changing direction, things of that nature. So Mike had his ACL reconstructed. How long ago was it reconstructed now?
It's been about roughly 8 years now.
Okay, 8 years ago. Now, he re-ruptured it how long ago?
That's probably about 4 years ago.
Okay, 4 years ago. So now we got a bit of an unstable knee. So one of the first things we want to talk about is this idea of instability in his knee. Now, here's the key thing. We can brace this individual with an unstable knee as a result of an ACL re-rupture, and or we can get him started on the exercise program. And then always there's the option of having a second surgery. Now, at this point, I think Mike is not looking for a second surgery because he just had his newborn baby, Mike Jr.
Right.
So I think at this point he's worried about Mike Jr. a little bit, not so much having this ACL reconstructed. And I don't think he's going to play for the Rockets this year. They're just about ready to go to the playoffs. So, okay, we'll catch him. He'll catch him on the championship.
Yeah.
So here's the deal. If you would, Mike, pull up both pant legs for me. Now, here's one of the first things our medical exercise specialists would look for. We're looking at his quad bone. Now, he's got well-developed quads, but you can see with this quad, it's a little less developed, just slightly less. You can see here the medialis isn't quite as well developed. Now, please remember one thing. The vastus medialis is your insurance policy against developing patellofemoral syndrome. That's one of the key things that we need to work on. And we're going to show you an exercise here now to work on that. But another exercise we're going to work on is just improving overall leg strength, the body or the leg's ability to lift your body weight, such as going up and down stairs, going up and down curves, and more importantly for the athlete, just being able to support themselves when they cut and turn. So we're going to show you two exercises here. Now, the key to all of this is medical exercise training is one of the most important elements after physical therapy, chiropractic care, surgery is over. At some point, those medical services end, and the client is now left on their own. So we have to provide them with some type of protocol-based approach to exercise that's going to produce an outcome. And the outcome we want with Michael is we get a nice, well-developed quadricep. He's fully functional when he goes back and plays sports. And more importantly, he doesn't develop PFS or patellofemoral syndrome. Fair enough? All right, so here's what we're going to do. We're going to show you the first exercise is standing terminal knee extension. Now, for all our medical exercise specialists out there, they should use this exercise for you. If you have any type of knee disorder, standing terminal knee extension is good because it helps to strengthen the quad, but more importantly, it helps to accentuate the firing and recruitment of that vastus medialis. So Mike, if you would, please. Now, we actually use ours. Go ahead, and I'm going to ask you to put yourself up here for me. We use just simply a cable collar unit. You can use rubber tubing, whatever you like. Now, Mike, as I said, is one of our MES, is actually one of our recent graduates, so he knows how this works. He uses this with his clients. And what we want him to do is step far away from the machine that he actually has resistance. So the resistance is actually pulling his knee into a little bit of flexion. We want him to keep the opposite foot, heel, and foot down. And what he's going to do is just simply extend that leg. What that does is it engages the quadricep and it really accentuates the firing of the vastus medialis in those last few degrees of knee extension. Now, what we normally have clients do is they'll do sets of anywhere from 15 to 25 reps of this, and they may do 3 to 5 reps of this during the course of the exercise program. Now, we can do it one of two ways. We can do it where the heel comes off the ground, or we can do it in a manner where the heel stays on the ground. When the heel comes off the ground, what that does is it engages the gluteus maximus a little bit more. When the heel stays on the ground, that now brings just simply the quadricep in. So as I said before, we do this in sets of 15 to 25 reps. Once he's done with this exercise, we have a number of other exercises that are included in our medical exercise training protocol for the ACL. So we just wanted to demonstrate this one. This one is vitally important because it helps to strengthen the quad, but also to fire that vastus medialis. So Mike, I'm going to ask you to take that guy off for me, please. The next exercise we're going to show is done with a simple suspension strap here, and he's going to do just simply a single leg press, okay? So basically a single leg squat. This is important for overall leg strength. So we're going to have him just simply, he's going to hold the uninvolved leg out, and he's just going to squat on this guy. Now, one of the key things here is we need to make sure the client doesn't have any patellofemoral syndrome, no difficulty with this, and also more importantly that they don't have a meniscus tear. A meniscal tear can really cause a problem with this. So one of the key things with ACL clients is our medical exercise specialists are trained to make sure they check to make sure there's no ACL damage that also is accompanied by a meniscal tear. All right. So we have to do normally anywhere from sets of 10 to 15 reps for that. And then after that's done, there are a number of other exercises the medical exercise specialist you're working with will have you do. Now, we have medical exercise training protocols for some 60 different conditions. In this segment, we've talked about the ACL. So there are guidelines, there are functional outcome measures, there are goals for each one of our protocols. So if you would find a medical exercise specialist in your area, they're specifically trained to bridge that gap between healthcare and fitness and use exercise as the solution to helping improve your outcome. Now, the medical exercise specialist is not trained to provide any aspects of physical therapy, chiropractic care. They're not there to be used in lieu of medical professionals, but to augment the services of medical professionals. So thank you for taking the time to watch. And in your community, the medical exercise specialist provider in your community is Jason Hodge, as well as Michael McCaskin. And Jason is the owner of Medical Fitness Pros in Katy, Texas. You can get in touch with him with the information we'll provide on the screen. So thank you, best wishes to you, and thank you for watching this video.